Folks, and welcome. I'm delighted to welcome you all to today's event, promoting diet and healthy weight, what a whole systems approach can deliver. Just to do the obligatory housekeeping first, as you've seen, the toilets are out of this door. I think it's ladies on the left, gents on the right. There is no expected fire alarm today, so if one does go off, it is not a drill. So look for the green signs and look which way Lorraine Tulloch is running and follow Lorraine. And in terms of social media, Wi-Fi, etc., that's all behind me on the screen. So feel free to tweet away with the insights you're going to get from today. So it's fantastic to see so many people here today to discuss and focus on an area of such importance and such challenge. FSS has a statutory responsibility to help improve Scotland's diet, and we all know the challenges we face in achieving a long-lasting and sustainable improvement in this area. It's fair to say our progress against the Scottish dietary goals, quite frankly, hasn't been to a level that has made sufficient difference. So what is a whole systems approach? Well, briefly, as I'm sure many of you are familiar with the concept, it's about everyone working more effectively together within a system. The methodology itself is designed to be flexible in the approach and enables a broad range of stakeholders to identify and understand where they fit within the system, but perhaps more importantly to be able to then make corrections and connections with the broader problems associated with diet and healthy weight and work together to achieve a sustainable change and improvement. The whole systems approach epitomises a health in all policies approach, drawing on local authority strengths, supporting their key priorities and recognising that local approaches can be more precise in better targeting and supporting the local community it serves. Critical to that is local community engagement and the use of local partnerships to make a difference. And that's why we're here today, to understand, learn and listen to an approach that we all hope will make a difference. This first session looks at a national approach to promoting diet and healthy weights and provides an opportunity to hear about the varying systems approaches to diet and physical activity adopted in the UK. Because what we do know is that there isn't a silver bullet answer to this topic, so learning from each other is critical in how we progress. Our first speaker in the session today is John Nicholson. He's the Deputy Director for Population Health Directorate in the Scottish Government. He joined the newly formed Population Health Strategy and Improvement Division within the Population Health Directorate. This is a long title, this, John, in Scottish Government in April 2023. So I think he might come under the relative novice in terms of diet and nutrition. Notwithstanding that, John has worked in SG for over 20 years. Prior to his current role, has worked in a wide range of policy areas, including COVID testing and contact tracing, leading the Scottish budget process, police and fire reform, sponsorship of the Scottish Fire and Rescue Service, and working in ministerial private office. So he's now, you're going to have to forgive this, he's now blazing the way on diet and nutrition. Over to you, John.
Thanks, Jeff. I don't think I've got any jokes in my presentation, so I'll try and focus on the... Oops, we've gone too far, sorry. Back one. Here we go. Okay, so thanks, Jeff. First of all, thank you to Obesity Action Scotland for the invite today to come along and speak to you at this event. And as Jeff said, I've only very recently taken up this role. It feels like yesterday. It has been 6 or 7 weeks, people tell me, so I should probably know more than I did when I arrived, and I'm hopefully not going to fail on that front today. So I think the important thing to tell you about that new role, which Jeff has indicated is quite a long title, but it also has quite a breadth of responsibilities attached to it. So what it does is it brings together a number of complementary population health policy areas, and that includes diet and healthy weight, the topic and focus of today, along with tobacco, alcohol, health inequalities, prisoner health care, gender identity health care, physical activity policy, and also, more importantly, actually an overarching piece that looks at health and social care reform and how we can bring that together in a more coherent way. So there's plenty for me to be getting on with, of which this is one really important part. So I'm delighted to join this event today and to celebrate the work on the whole systems approach to the diet and healthy weight pilots. And I would like to pass on my thanks to a number of people who have been involved in that work. So firstly, with the early adopter areas for the great work and efforts to pilot these approaches and contribute to the evidence base that we have building, to Obesity Action Scotland, both for arranging this event today, but also for providing that national coordination role in relation to this work, to Public Health Scotland for their work leading on and publishing the national evaluation, and finally to Food Standards Scotland for their support as a national partner in this work. So, as we all know, Obesity Action Scotland will be presenting later in the day, and we've got a number of important and interesting presentations to come, and particularly on how we've looked at implementing whole systems approach to diet and healthy weight, which we look forward to hearing more about later. I'm here today to set some of that overarching national context and how whole systems approaches can underpin Scottish Ministers' national priorities. At Scottish Government, whole systems approaches are increasingly being seen as influential in responding to the complex, multifaceted, multifactored public health issues such as diet and healthy weight. Our newly appointed First Minister equally recognises the importance of working together, and in his first major statement to Parliament back in April, Mr Yusuf set out that 3 missions centred on the themes of equality in order to tackle poverty, opportunity to support economic growth and the delivery of a wellbeing economy, and community to support the delivery of effective public services will be central to his approach to government, and they all resonate with the work that we're here to talk about today. The First Minister's statement was also accompanied with the publication of a new policy prospectus, and in that, the Health Secretary Michael Matheson outlined that he will work with his Cabinet colleagues to tackle inequality, reduce poverty, and focus on preventing ill health and reducing health inequalities. This renewed focus builds on our existing national performance framework, which sets out the national outcomes that bring to life the kind of Scotland that the Scottish Government wants to see, including one where we are all healthy and active. The two things that we are, these two things cannot be achieved in isolation of each other, and we recognise that a system-wide approach that encompasses where we live, learn, work and play is key to their successful delivery. And we've seen examples of where whole system approaches have worked successfully in Scotland before, in other major policy areas such as smoking and tobacco control. And more recently, we've had the work from Public Health Scotland to develop the systems-based approach on physical activity. All of this, along with the National Diet and Healthy Weight Evaluation, stands as a valuable body of learning that we can use to support further whole systems approach work as we move forward. This work all sits in a broader context within the health and social care portfolio. So Scotland continues to face significant population health challenges, with stalling and in some groups falling healthy life expectancy and widening levels of inequality, which have been exacerbated by the COVID-19 pandemic. Our whole system is not, and not just healthcare, is facing significant pressures. Delivering effective population health and preventative measures is one of the most important ways that we can disrupt this cycle of continual challenge. The underpinning framework of our policy approach that we've adopted within health and social care is the evidence-based Marmot model of factors. This globally recognised framework, which was set out in Fair Society Healthy Lives in 2010 and was updated in 2020, identifies a number of factors that should be considered when forming policy objectives to create health and reduce health inequalities. These include, as are shown down the left-hand side of this slide, ensuring ensuring good early years, good education, good work, good income, healthy places, good ill health prevention, tackling discrimination and racism, and importantly, environmental sustainability. The care and wellbeing portfolio, as it says at the top of the slide, is the approach that we're taking as the principal reform vehicle within health and social care in the Scottish Government, in which these policy objectives are taken into account. It brings oversight and coherence to the major health and care reform programmes with the objectives of improving population health, addressing health inequalities, and improving the health and care system's sustainability. The long-term strategy of the portfolio is to be much more systematic, influential and deliberate about the multiple and related actions on prevention and innovation that we can take to maximise the potential impact on our outcomes. The right-hand side of the diagram then shows a prevention lens that we can map our established portfolio components onto. And these domains onto the domains that we know improve health. Public Health Scotland helpfully produced and published a paper in January on a public health approach to prevention, and we used that both internally within the Scottish Government and with external partners to promote a shared sense and consistent use of language around what we mean by prevention. So that's primary prevention, stopping the health problems emerging in the first place and keeping that way for as long as possible. Secondary prevention, finding problems early and intervening to reduce the risk of them getting worse. And then tertiary prevention, managing problems to reduce their harm. And as you can see, there's a range of activity that we're taking forward across each and every one of those at present. We recognise factors that impact on people's health and well-being go well beyond what the health and social care system itself can deliver. And the King's Fund model, which is the kind of man in the middle, if you want to call it that, on the slide, shows that those wider determinants of health in areas such as income, employment, early years, social security and transport will make up around 50% of the contribution towards good health. The care and wellbeing approach provides a vehicle for collaborative leadership across government and beyond on critical cross-cutting issues and wider determinants of health that will contribute to our overall objectives. The pilots on diet and healthy weight whole systems approaches, which we'll hear more about today, are great examples of this in action. Moving back to focus in on diet and healthy weight. Piloting a whole systems approach to diet and healthy weight was included as an action in our framework back in 2018, delivery plan back in 2018. The plan set out Minister's vision for a Scotland where everyone eats well and has a healthy weight. It included our bold ambition to improve child health and having childhood obesity by 2030 and to significantly reduce health-related inequalities, a commitment that Ministers reaffirmed back in September 2021. To realise this vision, we're working towards 5 key outcomes, which will be familiar to all, I'm sure. Firstly, for children to have the best start in life, to eat well and have a healthy weight. Secondly, the food environment to help support healthier choices. Thirdly, for people to have access to effective weight management services. Fourthly, for leaders across all sectors to promote healthy weight and diet. And finally, for diet-related health inequalities to reduce. Clearly, these outcomes cannot be achieved without action across Scottish Government and across all sectors of society. And this is consistent with the approach that I set out a moment ago in terms of how we're approaching the care and wellbeing portfolio. Having childhood obesity by 2030 is a significant ambition, which has been made more difficult by the cumulative external shocks, including the pandemic and the cost crisis. However, no matter how challenging, Scottish ministers are clear that the importance of seeking to achieve this aim remains, and a whole systems approach to improving diet and healthy weight is the strongest evidence-based route to helping succeed. So I welcome the work that we will hear more about over the course of today. This diet and healthy weight whole systems approach has been a key priority for the Scottish Government since the publication of our delivery plan. We are grateful to Obesity Action Scotland for acting as the national coordinator of the pilots and ensuring that we had the right expertise in place to support this work. We were also keen to ensure that a robust evaluation was in place to gather the evidence required to support future phases. That is why we funded Public Health Scotland to undertake the national evaluation, and we thank them and other partners for their work and providing this key learning. We cannot ignore the impact that COVID-19 has had, both on individuals and communities, but also in relation to the work that we had to pause temporarily to prioritise our response to the pandemic. However, we were determined to continue our support for the early adopter areas through the pandemic, extending the period to allow the pilots and the national evaluation to complete, and we are very grateful to those who continue to work with the pilots through that period. As this audience will know better than most, population-level interventions are so important when it comes to addressing poor diet, promoting healthy weight and reducing diet-related health inequalities. Achieving Scotland's dietary goals and our aim to halve childhood obesity demands action to transform the food environment, that is, the environment that influences what we eat, buy and to support healthier options. This is our focus, as it is more likely to be effective in reducing health inequality than measures aimed solely at encouraging people to change their individual behaviours. An example of this is our firm commitment to restrict less healthy food and drink promotions where they are sold to the public. As you will all be aware, the Minister for Public Health, Jenny Minto, last week updated the Parliament on these measures, setting out that the Scottish Government will proceed directly to consult in the autumn on the detail of proposed regulations. This is evidence of the Minister's commitment to drive forward action to improve public health by taking a more direct route to delivering promotions policy. In short, the decision not to introduce a bill will see regulations laid sooner than would otherwise have been the case, and subject to the outcome of the consultation will be proceeding shortly. This change in legislative approach is in no way changing the aim and intended outcomes of the policy, which is to reduce public health harms associated with excess consumption of foods containing calories, fat, sugar and salt. This will support us to help people reduce the risks of developing type 2 diabetes, various types of cancer and also other conditions such as cardiovascular disease. In addition, we have made some substantial progress on actions from our delivery plan and in other areas too. We are working with Food Standards Scotland and Public Health Scotland to develop our Eat Out, Eat Well framework and code of practice for children's meals to support healthier options. We've maintained support for the Healthy Living programme and community food networks, ensuring that people have better access to healthier choices and food options. Public and dietary health also sits at the heart of a range of our support for families struggling through the cost crisis, including Best Start Foods, healthier free school meals for eligible children, and the recent publication of our plan to end the need for food banks in Scotland. Last year, Parliament passed the Good Food Nation Scotland Act, and this will lead to the development of national and local plans to support everyone in Scotland to have ready access to healthy, nutritious food they need, and that dietary-related conditions are in decline. This is by no means an exhaustive list of the work that we are progressing, and doesn't include other wider commitments and policies such as progress with tackling child poverty and other wider factors. But it demonstrates that the Scottish Government does remain committed to the priorities that we have on diet and healthy weight. We continue to work in partnership, both within and with the Scottish Government, to deliver on those national priorities and to achieve our goals. To conclude, I would like to thank Obesity Action Scotland again for the invitation to speak today and for the opportunity to address this audience. I hope that the resources being made available to local partners, building on the learning of the early adopters, are useful, and that these resources will support the use of whole systems approaches in the future. I and the wider team at the Scottish Government look forward to working closely with our key stakeholders, both to hear how we can continue to support and promote the uptake of whole systems approaches, and crucially, how we can continue to make progress towards our common goal of improving health by taking preventative action to improve diet and levels of healthy weight in Scotland in ways that reduce health inequalities. Thank you very much.
Thank you, John. Right, we're going to move on to the next speakers, which is Sophie Bird and Lydia Orford. So it's Lydia first? Sophia, sorry, it's Sophia first. So Sophia has worked in public health in Wales for over 20 years. She started as a research and evaluation officer within a health board health promotion unit, and since then has worked on numerous topics including mental health promotion, children and young people, perinatal and infant mental health, immunisations and veterans' health. Sophia moved from a local public health team to the National Public Health Wales Obesity Prevention and Nutrition Team in 2019, supporting the delivery of Healthy Weight, Healthy Wales strategy for Wales. Since COVID-19, Sophia has focused on setting up and coordinating the All Wales Healthy Weight Whole System approach alongside a couple of other work streams. I'll do Lydia's introduction now before we start. So Lydia has worked in public health for over 20 years too, within England and Wales and within the NHS and local authority. Lydia is a principal public health practitioner. This is a challenge, isn't it? Betsy Cadwallader University, was that a good? Health Board Public Health Team, and is leading the work around the whole systems approach to healthy weight in North Wales. Lydia joined Public Health Wales in 2021 from Cheshire West and Chester Council, where she led on the Eat Well Be Active agenda for the council. Previous roles involved working in public health in the NHS in Cheshire and Bury and for an enteral nutrition company. Lydia has a degree in nutrition and a master's in public health. Thank you very much.
So thank you very much for being here. It's a real pleasure. We're delighted to be able to come up from Wales to present to you today about our experience of the whole systems approach in Wales. So just to give you a little bit of background to our context, similar picture to Scotland, I believe. 61% of our adults experience overweight or obesity. That's rising by around 10,000 a year. There is a prediction that if that carries on, then over 2/3 of our population would experience overweight or obesity by 2030, which doesn't feel very far away these days. Males are more likely to experience overweight than females. Rates are higher in men and women over 45, and as with lots of places, higher rates in our areas of deprivation. Just wanted to give a little bit of an explanation of Wales in terms of our strategic context. So the map is showing our 7 health boards. We have 22 local authorities within our 7 health boards. Most of the health boards have 2 or more local authorities within them, except for the dark blue one in the middle, which is where I live, which is our most rural county, and that is the one area that has 1 local authority, so it has coterminous boundaries, but most of the others have between 2 and 6 local authorities within them. We have a couple of pieces of legislation that has made a real difference and that helps us with our strategic journey. The Social Services and Wellbeing Act was an act in 2014 that really pushed health and social care responsibilities towards prevention. And then the Wellbeing of Future Generations Act, which was focused more on local authorities, again, really pushes local authorities and other corporate and statutory agencies to have a duty of care towards their citizens, to be thinking of the longer term. There are key ways of working that sit under those pieces of legislation that reflect the Marmot principles, including the aim for Wales to be a more prosperous Wales, a healthier Wales, a Wales of strong Welsh language, and a Wales of reduced stigma and bias. And so these really set the frame for the expectations of our statutory agencies to be working together, to work cohesively, to work with communities. So, for example, part of the work under our local authorities, they have to come together as a board. The chief execs from key statutory agencies, they have to do wellbeing assessments, they have to do wellbeing plans every year and refresh these. So our systems working sits within that context. And then we also have our Healthy Weight, Healthy Wales strategy, which was published in 2019, and that has 4 themes. And the 4th theme is about leadership and enabling change, and that is the strand that our systems work is being delivered within. So our systems work has 3 key phases. The first phase was establishing the programme nationally. COVID slightly delayed things, but we really started going for it in 2021, I guess. We developed our approach nationally, we developed our governance, and we started the recruitment of our regional leads. And Lydia, my colleague, will be talking very shortly, is one of our regional leads. And then their work, once they were in post, was about establishing that regional setup, mapping the strategic system locally, and beginning that system engagement. So we're currently on phase 3 at a local level, where the different health board areas are beginning to identify which part of the system they're going to focus on. So we're taking a fairly pragmatic approach. We reckon the system around healthy weight is enormous. We need to start with one piece of the pie, sort of thing. But a key part of our approach is that if each health board is focusing on a different bit of priority system, we can share the learning as we go from those different systems. So hopefully it builds up a bit of momentum that we can share the learning across the whole of the nation. We've developed a 9-step approach. It's similar in some ways to the Leeds-Beckett approach, but it is a very pragmatic approach. You won't be able to read all of this probably quite that easily. But we recognise from the literature that the first 3 or 4 steps are really crucial. Getting that set up and buy-in from those key strategic stakeholders, the local leaders, doing that understanding of the system that you're working within and the mapping. And we're not just talking about the causal mapping here. We've been mapping who the key stakeholders are, what the key partnerships and networks are in the regions, how they fit in and relate to each other, where they don't relate to each other, what those gaps are, and how we can strengthen the system. And then we're going into the causal mapping to help everybody come together to understand where those levers for change might be. Alongside the recruitment of our local coordinators, our local systems leads, and their work, we've been delivering a lot of training around systems thinking, systems mapping, network analysis. So we're really building up that knowledge and capacity and understanding around what the whole systems approach is in practice as well as in theory. And obviously we've been doing some national asset development. So just a little snapshot of one of the steps. This is the step around system engagement. The columns relate to each of the health board areas. Two health boards have actually joined together to deliver a regional approach. And so they've all been holding workshops or engagement events, pulling key strategic people and organisations together, getting those conversations going, getting people around the table, beginning to help them to understand systems working and how it's different from partnership working the traditional way, and doing a lot of work really to keep getting people to think this isn't about interventions, it's not about doing things to people, but it's about how our organisations operate and how we can actually get our organisations better aligned within and across departments and across organisations. And so this is an example of the identification of step 5, our priority and goals. So a couple of our health board areas have already identified the system, the priority system, the subsystem that they're going to focus on. In Betsy Cadwallader, and Lydia will tell you more about this shortly, they're focusing on access to affordable and healthy food and eating well and being active in workplaces and schools. In Cardiff and Vale, which is right in the south of the country, They're focusing on healthier advertising and marketing, initially working with one local authority and now working with the other local authority as well, looking at all the advertising spaces that the local authority owns or licenses. In the other areas, they're still at their themes, and they're now trying to continue that system defining and boundary of the systems. So, and they vary from early years, active travel, children and families, access to healthy food. So the journey is going on, and each health board area is in a different place, but we're all following the same basic steps. Nationally, as well as doing this coordination, we're also doing the same process. So we've held our first national event where we brought together different government departments, which doesn't always happen that well, as well as a lot of our key third sector agencies. And we're planning 2 events for the autumn now, one specifically focusing on the planning system and another one to draw together those key stakeholders that came to our first event, and hopefully those who maybe didn't see it as their job or part relevant to them, but are now beginning to understand that they are part of that system. I think really a couple of the key messages I would say is that we've been really lucky in Wales. Wales has funded this approach, and that funding has not only provided opportunity for capacity building at a local level, but provides capacity nationally to coordinate this approach as well as delivering it at a national level. And I think that's really helped at so many things. So we are going to begin to start seeing, and we're already beginning to start seeing, that interplay between levers pulled locally that has implications, intended and unintended consequences at a national level, and vice versa. So it's been, we're already seeing the fruition of having that really strong national approach and our links with Welsh Government. I'm going to hand you over to my colleague Lydia now, who will take you through that experience at the local level.
Thanks, Sophia, and good morning, everyone. It's great to be here with you today. So you've heard from Sophia around the Healthy Weight whole system approach in Wales. And as Sophia detailed, there are Healthy Weight whole system teams in each health board area across Wales. And I'm going to talk to you about our journey in North Wales. So as a team, we have worked through the 9-step process over the last 20 months. So our journey began in September 2021 when the whole system team started. We're based in the public health team in the Betsy Cadwaladr University Health Board, which is in North Wales, and a part of the wider Wales-wide implementation team led by Sophia. So we started with steps 1 and 2, so that's that set up and buy-in and defining the system and mapping. And they were carried out between September 2021 and February 2022. And as Sophia said, you know, really important steps there to get that senior leadership buy-in to the work that we're doing. Between March and May 22, we carried out steps 3 and 4, so system narrative and system engagement, including carrying out a social network analysis to see how partners and stakeholders were connected across the Healthy Weight agenda, and I'll show the results of that in a moment. Between June and September, we set our priorities and goals, so step 5, and between November and March of this year, we carried out a further social network analysis on one of our priority subsystems and started to produce our action plan, so steps 6 and 7. And that brings us to where we are today, and that's steps 8 and 9, mobilise, manage and review. So this is the social network analysis results. This was delivered at the very beginning of our journey. So the aim of a social network analysis is to understand the relationships in a system and as part of a network. And this helps us to learn how information and resources are shared across the network and who might be more influential in creating change. So this provided a baseline network of our current Healthy Weight system in North Wales and to understand who is central and influential within the system. 2 collection methods were used for this, so desk space, so data on who sits on which partnership boards, to understand who has access to the system. And also a survey, so where we asked people who they spoke to regarding Healthy Weight, and that was distributed among attendees at 6 system mapping workshops, which I'll touch on in a moment. This map shows that the Health Board and Public Health Wales receive the most inward connections, suggesting they are most connected within the system. We hope to repeat this survey on a regular basis to show the system change through the work here in North Wales. So what we would hope to see is over time, those other partners who work within that healthy weight agenda will become more prominent within the system. So we'll be repeating this on a regular basis. So we held 6 system mapping workshops across North Wales in March 22. We had over 80 partners and stakeholders attended, and they were asked what factors are perceived to cause obesity in North Wales. We identified 94 causes, and that was what was great about bringing partners and stakeholders from a variety of organisations together. So we had planners in the room, we had leisure, we had elected members, we had third sector organisations. So we were able to bring together lots of different views. And we, as I say, generated 94 causes, so similar to the Foresight number of causes identified within the Foresight map. We had 23 maps produced and identified themes within the map, and then we pulled the individual maps together to create our system map. And if anyone can read any of the detail on that, you'll be doing amazingly. However, what I wanted to show was the complexity of the issue. So within our 23 maps, we identified 5 key themes. So participation in physical activity, the availability and affordability of unhealthy food, pre and post conception, education and infant feeding, uptake and continuation of breastfeeding, and mental health and well-being. So it's important to remember that while that map is really useful and we're using that to direct the work that we're doing, it was also great to bring people together and map those causes collectively as a system. We then held our priority mapping workshop in September 22 and prioritised our themes using action registers and the action scales model. And this was to ensure participants were thinking beyond that event level action and considering the long-term sustainable system change and thinking about system structures, system goals and system beliefs. There are 3 priority subsystems which have been identified through the priority and the system mapping. And there'll be a golden thread of mental health and well-being, health inequalities and climate change running through our priority subsystems. Just one example of a whole system approach has been around the work that we've done around spatial planning and health. So we've developed a new system for the public health team, 1 to contribute to the health board response, but 2 proactively check in the planning authority weekly planning lists. We've developed a series of response templates, and that contributes to our subsystem and the national priorities. So school development applications, food premises, nursing homes, green spaces. So where are we now? Our governance structure is established and we have our first strategic partnership board later this month. We are also establishing our priority subsystem working groups, and we've launched our strategic delivery plan at the end of May, where we brought partners and stakeholders together. And what was great there was to see the journey we'd come on from our first workshop and how a wider variety of partners and stakeholders had come together at our next event. So I hope that gives you a flavour, both nationally and regionally, of the work that we're doing in Wales. There are contact details. Please do get in touch if you want to find out more, want to chat to us about anything. And Sophia and I will be around all day if you want to grab us at the break or lunch. Thanks very much.
Thank you both. Okay, our next speaker is Gerard Walls. He's the Senior Health and Social Wellbeing Improvement Officer in the Public Health Agency in Northern Ireland. Gerard has been with the Public Health Agency in Northern Ireland with a regional remit on physical activity and obesity. Gerard has been involved in the development and implementation of a whole systems approach to obesity within Northern Ireland. Gerard also brings experience from working across local authority and the community sector, overseeing the delivery of community health and wellbeing services.
Good morning, folks. Today's presentation is going to look at the implementation of a whole system approach to obesity prevention within Northern Ireland. Our journey started about 18 months ago, so we're probably just a few steps behind what we've seen in England, Scotland and Wales. So just to put a bit of context on what obesity currently looks like in Northern Ireland, 65% of the adult population in Northern Ireland are either overweight or obese. That's up from 62% from 18-19 statistics, and it's 9% away from the 2022 A Fitter Future for All target of 56%, so we are moving in the wrong direction. 22% of children in Northern Ireland entering primary 1 are already living with overweight or obesity, and that raises to 27% in year 8. 47% of the adult population do not meet the recommended levels of physical activity, and 87% of the children aged between 11 and 16 do not meet the recommended levels of physical activity. Obesity is strongly linked to deprivation status. Living in deprived areas are less likely to meet healthy eating and physical activity guidelines. So we have a number of strategic drivers. Sorry, 2 seconds. It's just my notes weren't coming up on the screen there. So within Northern Ireland, we have a number of strategic drivers. We have Programme for Government. We have Making Life Better, which is the Executive's 10-year Whole Systems Public Health Framework. We have Community Planning, working across sectors within communities and where change is needed most. And of course, we have our current transformation programme, which includes Health and Wellbeing 2026, Delivering Together, and Systems, not Structures. A Fitter Future for All is the current obesity prevention strategy. It's a regional framework for preventing and addressing overweight and obesity within Northern Ireland. Due to the pandemic, it was delayed. It's currently in development for the new strategy, and it should be going out for consultation in around November time. There are a number of other strategies and frameworks which do influence towards health and obesity as well. So those strategies will sit within Department of Communities, Department for Education, Department for Infrastructure, and Department for Agriculture, Environment and Rural Affairs. But basically what that represents is health is everybody's business, and we can't do it alone, especially within a whole systems approach. So just kind of looking at the first presentation, there's many different determinants and factors towards health. We know that postcode accounts for about 50% of health outcomes. And what that means is we can't just focus on behaviour change. We have to look at the wider picture and the whole system. So implementation within Northern Ireland, what that looks like is, I'm just going to touch slightly on the Institute of Public Health Rapid Evidence Synthesis, and that was conducted in 2022. I believe Gavin Breslin's going to present on it later. But that's a key document for both policy and implementation of a whole system approach to obesity within Northern Ireland. It's likely to feature strongly in both the new obesity strategy for Northern Ireland, in Northern Ireland, and also the PHA's implementation of a whole system approach to obesity within Northern Ireland. Our first steps back in November 21 was actually meeting with Obesity Action Scotland. That early and initial discussion helped in conceptualising how a whole system to obesity might look and how it may be implemented within a Northern Ireland context based on what was delivered in Scotland. It was with meeting with Niamh that we learned that Northern Ireland-based academic Gavin Breslin was involved in the work, and we've been able to involve Gavin within the Northern Ireland context since then as well. In regards to implementation, we're going to be looking towards the Leeds Bucket model. Using the PHA approach across the 6 phases, we are planning on implementing the whole systems approach at a local level in line with local council areas, by aligning local area partnerships to community planning for collaborative gain. Early adopter sites will be embedded within the local council areas. PHA Health Intelligence will assist with statistics, inequalities data, and mapping of the current programmes. PHA will provide training from relevant experts to train people in whole system approaches and systems dynamics, looking at that kind of cause and effect. So this is what the current structures look like within Northern Ireland. We have our four tiers of healthcare. Above that, we have the Department of Health. So Tier 1 and Tier 2 is your prevention. Tier 3 and 4 is your clinical intervention and treatment. In regards to obesity prevention, that would sit within Tier 1 and 2. We have the Obesity Prevention Steering Group, who would sit overarching, and that's led by the Department of Health, and they would very much lead on the policy and the strategy. We then have the Regional Obesity Prevention Implementation Group, ROPIG, which is then led by PHA. That's where we have our wider stakeholders. That's where we have health, education, Food Standards Agency, Sport and Eye, community and voluntary sector. That's where we have our wider stakeholders involved in. How we adapted the model to fit with whole systems approach, we now have a whole system approach task and finish group which sits within ROPIG, and that will be the advisory group moving forward for the early adapter sites and a whole system approach for Northern Ireland. Some of the first steps was then kind of upskilling and upskilling staff from public health and upskilling members from ROPIG. So between March and May 2022, approximately 30 staff from PHA Health Improvement and ROPIG members received free training sessions from Leeds Beckett University on systems thinking, system change, and a whole systems approaches and evaluation. Our next step was to produce a briefing paper and to then approach the local authorities. So we have 11 local authorities in Northern Ireland. So we then presented to senior leadership. From that presentation, we had an expression of interest from 6 councils seeking to work as the early adapter sites. What the next phase was looking at the level of readiness to engage and deliver. And what we asked from the local councils is that we had a local steering group, hopefully a subgroup, a health subgroup within the community planning, who would then kind of act as that steering group, look at the local systems and so on. And then we had the core working group, which is about 4 members from public health, the local council, the local trust, or another, and then somebody from community planning partnership as well. Then we also have the within that system, we also have the task and finish group from ROPIG as well, who will be involved in that work. What we can offer from PHA in regards to support is staff time to support the process, funded training for relevant stakeholders, support the collation of data and intelligence, so that's kind of linking back into phase 2 of the PHA model. Training and facilitation, support for phase 3 of the PHA model, so that's mapping the local system. Ongoing support for phases 4, 5 and 6. And then that process evaluation piece. We've been lucky enough that we've been successful in a application process with the first research team. So that'll start looking at the evaluation process within the next year. And then we can also offer that support around a advisory capacity from ROPIG's Whole Systems Approach Working Group, which is facilitated by PHA. So how we're going to take it forward, we're going to do it on a phased approach, and that's based on readiness to deliver. So in the first phase, which is year 1, and that started in January 2023, Council 1, which is Argyle North Down Borough Council, they already had a whole systems approach to obesity embedded within their community plans, so they were ready to deliver right away. So Argyle North Down started in January, and then in September this year we have 2 other councils starting. Phase 2, year 2, we have a further 2 councils starting, and then phase 3, which is January 25, we have then the 6th council, the final council, then starting. So how our model is going to look, it's very representative of the Leeds Beckett model, the PHE implementation model. So in phase one, we have a setup with we've already done. We've engaged with the councils and community planning partnerships. Phase two is building the local picture. So that's looking at the training, building that local picture, systems thinking, causal match, and then it's moving on to the local workshops and then our action plans and so on. Our next step was to bring all the early adopter sites together. So in March of this year, we had presentations from Gavin Breslin. We had presentations from Leeds Beckett University. We had then a presentation from a colleague who implemented a whole system approach in Oxfordshire Council. From that training, we looked at the whole systems approaches theory, and then we looked at the practical implementation. So we've done a pre and post survey. So pre-survey, on average out of 10, it was a score of about 3.4 in regards to knowledge, and then post presentation it moved up to 6.6. So we can see right away that we're starting to embed that kind of system thinking. Arden North Down launch is our first early adopter site on March of this year. So how the timeline is going to look for Arden North Down, it's just reflective of the regional model. We're happy to say that this has been adopted and it's kind of embedded now within the council's community plan. So within the community plan, there's a outcome 2 and a priority 4, which is looking at health equity. But under that in 4.1, we have a whole systems approach to obesity. And we started in January to March of this year, starting to look at those kind of mapping the local assets, local programs, local services and so on, kind of building that picture. And then our next step is looking at workshops with the wider community planning partners. So, within the Northern Ireland context, unfortunately, we don't have direct data sources for overweight and obesity. It can be lacking at times, especially at a localised sub-regional data. We are mainly reliant upon proxy data that shows a strong relationship with overweight and obesity. Here's an example of some of the data sources that we are considering as proxy indicators for Arden North Down Borough Council as early adopter site 1 and phase 2 of building a local picture. Other data sources being considered are looking at diabetes rates within the borough as well. We are also in the process of mapping the existing interventions, existing assets, the programmes and services delivered within the council area as well. So it is mainly going to be the proxy indicators that we're going to have to lean upon, because most of the data for Northern Ireland is done on a regional basis. Okay, just moving on to the workshops. So we have our first whole system approach workstream workshop next week. What we're hoping to achieve coming out of that workshop is the initial thoughts and indications on what subsystem the focus on, whether that be gender, age, or geographical, or a theme based on nutrition, physical activity, where it happens to be. That's what we hope to take forward as an outcome from that workshop next week. Okay, what we're hoping to achieve long term from a public health perspective, in the short term, which is looking at 23-24, it's at stakeholder engagement, including communities, looking at the training and capacity building in whole system approaches, integrate systems thinking into practice across early adopter sites and its partners, cause and effect mapping, looking at the factors that impact overweight and obesity, collaborative working with departments and other organisations, development of a robust evaluation framework to measure outcomes and impact, and then moving on to the medium term, which is moving from 2024 to 2027, is the development and delivery of an action plan to address obesity and reduce health inequalities, development of a reporting against a set of performance frameworks associated with a whole systems approach work, evaluation reports and shared learning, and then long term, what we're hoping to get is the learning, the evaluation report, achieve the targets regarding overweight and obesity and physical activity in line with the new obesity prevention strategy once it's available, and then that long term systems change. Okay, that's me, folks. Thank you.
Thank you very much. Okay, it's just me sitting between you and break. First of all, thank you very much to the four speakers for four really good presentations. I suppose a couple of observations that that struck me in terms of the kind of common themes coming through. The first was the importance of leadership and the critical role that has in enabling change. The second point really is you need both a top-down and a bottom-up approach. So as John demonstrated, we still need to do things like tackling the food environment while we're working at the local level as well. The causes are clearly multifactorial. A lot of the challenges, particularly with the socio-economic factors we've seen, are not just about food, they are about other factors as well. I suppose the other thing that I was quite struck by was actually, Gerald was quite modest about only been going for 18 months, but actually what came across is how quickly you actually can move. People think systems approaches can be quite slow, but actually I think the evidence from today is actually quite quick. And there is this African proverb about if you want to go fast, go alone. If you want to go further, go together. And what has again come across is the ability to learn not only within the administration but between administrations as well. And focusing on what works, but probably as importantly, focusing on understanding what doesn't work as well. And that will save time and speed up as well. So thank you very much to the speakers. It's been a really good session, and the break is now from now till 11:40. So if you can be back in at 11:40, and there's a good chance to catch up with folks. Thank you very much.